guys, welcome back again to another health session with Asosika. In today's video, I'll be discussing about blood grouping, different types of blood groups, importance of knowing your blood group, and even if you know your blood group, who can you donate your blood to and whom can you receive a blood from? So your blood type is perhaps the first thing you would inherit from your parents. Yes. One thing you should know is that all blood does the same work. But they are not the same. Okay. So medically, there are four main types of blood. We have the A, the B, the AB, and the O blood. Now, generally, knowing your blood type is important in case of medical emergencies. But the thing is, to determine your blood type, or for the medical professionals to determine your blood type, it is done by the presence of a certain antigen. So we call it antigen, which is it is a molecule which induces immune response. Like if you are being exposed to any foreign body, that antigen will detect it and cause an immune response to that foreign object which has been introduced into your body. So anything which the body does not know or doesn't recognize, your system will recognize it as a foreign object or a foreign body. That means it will be like an intruder. Yes. So the body will try to, find its ways to kill it. So that is when your antigens will be stimulated or activated to give an immune response. Yes. So these antigens helps us determine your blood group. Look at what the blood contains. So the blood is generally we see it to be a liquid, a red liquid. So when you get hit, the first thing you see is a red liquid oozing out from your cut, and then you think, oh, that is blood. But wait, blood contains some components. The first thing is the red blood cell, RBC. So this RBC, do you know what they do? They carry the oxygen to the various organs and tissues in our body. So their job is to supply, they are suppliers of oxygen, O2, to any part of our body, which needs it. Yes. The next one is your WBC, white blood cells. So this white blood cells is an immune is a part of an immune system. Okay, so it basically fights infections and disease. So whenever you are sick and you take a blood test, your WBC count would normally, if you're having an infection, it will increase. Okay, so that will indicate that maybe there is an infection or there is something going on. So your WBC's job is to fight infections. The third one, which is the plasma, I like this one. So this plasma's job is to carry water. They carry water, the salt, enzymes, nutrients, hormones, and proteins to every part of your body which needs it. So its job is quite a little bit more than the other component, but it's also important. So it's also part of our blood. The last one, which is the platelet. Have you noticed whenever you get hit, you'll be bleeding for some time. After a few minutes, you see that the bleeding has stopped. So we call something bleeding time and clotting time. So this is the role of the platelet. So your platelet control your bleeding. Okay, how do they control the bleeding? They control your bleeding by forming clots. Okay, so when they form the clot, your bleeding stops. There is a series of mechanisms involved in this clotting process, which I'm not going to explain in this video, but maybe in our future videos I'll be explaining that. So there is a normal range, okay, for every person. It varies from person to person depending on certain conditions. So, but the normal range for your clotting time is 8 to 15 minutes. Okay. Then the bleeding time is like 2 to 7 minutes. So these are the four main important components of our blood. So henceforth, never think that blood is just some red liquid. Oh no, it is not just a red liquid, but it's a magical liquid which contains some important components which your body needs. Okay. Okay, so now that we know the components of our blood, let's look at the what we call the blood itself, the RBC. Now, RBC is one of the components in our blood. Okay, as I said earlier, there is something we call the Rh factor or the rhesus factor. So this is a type of protein. Okay, so it is a protein which is on the surface of our RBC. So I said the RBC carries oxygen to the various parts of our body, tissues, and organs. So this protein is on the surface of our RBC. Now, we inherit this protein from our parents. Okay, yes. Now, if you are having a blood group A, now the presence of this antigen, so the antigen is A and B. So the presence of the antigen A, meaning you are Rh factor positive. That means you have the antigen A if you're a blood group A. Okay, and you have antibodies B. So you have the antigen A and you have an antibody B. Now, if you are negative, that means you do not have this antigen present on the surface of your RBC. What if you are B positive? If you are B positive, it means you have the antigen B and you have the antibody A. Okay. Now, somebody who is AB, if you're a blood group of AB means you have both the A antigen and the B antigen, and you do not have any antibodies. Okay, and you do not have any antibodies. When you come to the blood group O, you do not have any antigen. There is no protein. The protein A and B is not on the surface of your RBC. You do not have any antigen. You don't have either antigen A or B. You don't have any of it, but rather you have the antibodies for A and B. Okay, so yes, so this is how we determine your blood group into the 8 category. That is A positive, A negative, AB positive, AB negative, and O positive and O negative. Okay, so now there are 8 different types of blood group. Okay, so let's look at who you can donate your blood to and whom you can receive your blood from. So if you're a type A positive person, you can donate your blood to A positive, AB positive, and receive a blood from A positive, A negative, O positive, and O negative. Type A negative, you can donate to A positive, A negative, AB negative, AB positive. Receive from A negative and O negative. Type B positive, you can donate to B positive, AB positive. Receive from B positive, B negative, O positive, and O negative. Type B negative, you can donate to B positive, B negative, AB positive, AB negative, and receive from B negative and O negative. Type AB positive, you can donate to AB positive and you can receive from all groups. All the 8 groups you can receive a blood from. Then AB negative, you can donate to AB negative and you can receive from A negative, B negative, AB negative, and O negative. Now type O positive, you can donate to A positive, B positive, AB positive, O positive, and you can receive from O positive and O negative. Then type O negative, which is the universal donor, donate to all the blood groups, all the 8 blood groups, and you can only receive, that is the limitation here, you can only receive from an O negative person if you're an O negative blood group. Now you may be wondering, okay, so if I know my blood group, what is the importance of it? It is important, one, very, very important and necessary to know your blood group. So I'll be explaining in the further slides, I'll be explaining the medical reasons why you should know your blood group, which is part of the video. So the first thing is blood transfusion. When you are brought into the hospital due to an emergency, let's say a trauma, you're involved in an accident, and there is a case of where you've lost lots of blood. So at that particular moment, in order to proceed with any procedure, any medical procedure, we need to give you blood, because even when you're going to the surgery, you need blood, because the doctors will be operating on you, and if there's no blood circulation, then it's a waste. So if you already know your blood group, it will be easier for them to give you the right blood. Okay, let's say you're an O positive person, and then you know that you're an O positive, let's say A positive person, you know that you're an A positive person. So when you come, we can give you any blood, whether an A positive, A negative, O positive, or O negative blood. But if we don't know, then the doctor opts for a universal blood, which is the O negative, okay, to avoid any reaction, because as I explained earlier, our blood contains certain antigens. What is the effect of receiving the wrong blood? Someone may ask, okay, so what if I'm an A positive person and I don't receive the blood that I'm supposed to receive, and I take a different blood which I'm not supposed to take? So if a person receives an incompatible blood type during transfusion, the immune system of the person receiving the transfusion goes into a massive activation. So your immune system will be activated, and it may cause certain reactions like clotting, which will result in complications like kidney failure, circulatory failure, and shock, and maybe possibly death. So knowing your blood group in emergency cases is very important. But if you don't know, doctors will not make a mistake to give you the wrong blood. Pregnancy. So if you know your blood group, okay, it will be very helpful during your pregnancy period. Whatever blood type you are, if you are a negative, if you are an Rh negative, there can be a problem, okay, during your pregnancy period if your baby is an Rh positive. So this Rh is a rhesus factor, as I said earlier, and I was explaining that we have A positive, B positive, AB negative, and all those things. Yes, so your pregnancy would need special care if you are, let's say, any blood type. If you're having a negative sign, which is the Rh negative, and your baby is having the Rh positive, so during your pregnancy term, your prenatal visit and all those things, doctors you'll be told to have a screening. Okay, so we call that as the Rh factor screening test, okay, in your first prenatal visit. So this test is done to detect whether your baby is positive or negative. If it comes out that your baby is positive, there are certain precautions as a mother you should take, and then why is it done? Yeah. So why is this test done? Usually your blood will not mix with your baby's blood during pregnancy. That won't happen. But however, in a case of any incidents and your baby's blood gets in contact with your blood, your body might produce proteins called Rh antibodies. Okay, so these antibodies aren't a problem during your first pregnancy, but it can cause a problem if you get pregnant again. So if the next baby, so let's say your previous pregnancy, you are negative. Let's say you are a negative blood type. Maybe you are A negative, B negative, AB negative, O negative, whatever blood type you are, you have the negative sign. Yes. Now, in your first pregnancy, you will do a test which will determine whether your baby is positive or negative. If your baby comes out positive, that means there will be certain precautions your health professional will talk to you about. Now, in your next pregnancy, so in your first pregnancy, there will be no problem, but in your next pregnancy, if the next baby is an RH positive, because in your first pregnancy your body would have formed an antibodies, okay, against this positive factor, this positive RH factor, if you're a negative mother. So in your next pregnancy, if your baby is an RH positive, the RH antibodies which were produced in your first pregnancy will cross the placenta and damage your baby's red blood cells, okay, which can lead to life-threatening conditions like anemia. Okay, so during the pregnancy period, a test will be done, as I said, to detect these antibodies, and you would be given an injection. Okay, this injection is known as the RH immunoglobulin, which will prevent your body from producing any reactions to your baby. Okay, so the thing here is that, don't get confused, the thing here is that in your previous pregnancy, your baby was a positive, had a positive sign, you were a negative mother. Now in your first pregnancy, your body will produce some antibodies, okay, which will be stored in your body. Again, if you get pregnant and the baby is positive, now that antibodies which were produced in your first pregnancy will cross your placenta into your baby's bloodstream, which will cause some condition like anemia. So to prevent that, in your second pregnancy, the doctor will require you to take an injection known as the RH immunoglobulin. Okay, so this will prevent your body from producing any reaction and your baby would be safe. So this is one of the most important reasons why you should know your blood group. The next one is genetics and certain medical conditions. Your blood type, okay, defines your genetics. So studies have shown that people with all blood types have a lower risk of cardiovascular diseases, but susceptible to gastrointestinal disorders. So cardiovascular diseases like conditions related to the heart, these O type people have a lower risk. That means it's a no for them. The percentage is like 10%, like 5, less than 10%, but they are susceptible to gastrointestinal disorders. One with a blood type A have a high rate of fertility. Yes, that is studies which have shown that. And people with AB and B are at an increased risk of pancreatic cancer. So these are studies that have shown, research people have made it known that knowing your blood group also can determine what kind of medical conditions you may have. The next one, which is my favorite topic, that is the diet and food allergies. So by knowing your blood group, you can find out about certain food that will help you and which will not, and certain food allergies also. So diet and food allergies is the next important reason why you should know your blood group. So your blood type antigen aren't just present on your blood, but also they are found in every part of your body, including your intestines, your lungs, and they play a major role in reacting to the food you eat. So this particular reason I'll be explaining further in my next video. So if you're really interested about staying healthy, please watch the next video that I'll be uploading very soon. So these are the 4 main reasons why you should know your blood group. Really important. Yeah, so this comes to the end of our studies today. We've learned a lot about the different types of blood groups, who I can donate my blood to, whom I can receive from, the importance of me knowing my blood group. So at this point, if you don't know your blood group, you should go to any or visit any nearest clinic or hospital around you and get yourself tested. Get to know your blood group because nobody takes responsibility for your health. Okay, so your health, your priority. So please don't forget to subscribe if you're new, share and like, and give your comments in the comment section. Tell me about what you think. Tell me about what video you would love me to be posting. And until I see you again, stay safe. Bye bye.